Hello everybody all over the world. I like to take this lovely chance to welcome here in Tanzania. Tanzania, they are waiting for you. The adventure from Tanzania is the best adventure all over the world. You are all welcome.
Hey everyone, welcome to Dar es Salaam, Tanzania. My name is Ben, one of the chief residents at Yale Radiology. It's been a long trek to get here from New Haven, Connecticut, but well worth the long trip. So now that we're well situated, I want to show you guys what we've been up to at the Muhimbili Hospital and University as part of the Road2IR group. As you guys may know, Road2IR is a non-profit organization helping to create self-sustaining IR programs in East Africa and more. Sometimes they might also have diagnostic radiology residents such as myself come share their radiology knowledge with the Tanzania Radiology Residents. Hope you guys like the video.
I'm Fabian Lohe-Gaup. I'm a junior attending in Interventional Radiology at Yale. Yeah, so Road2IR is a program that was really created to bring interventional radiology to settings that don't have interventional radiology, starting with Tanzania. So basically what we did here over the past 4 years is to establish an interventional radiology service and training program from the ground up. So I feel that interventional radiology has had quite a big impact here because we can basically offer procedures that are less invasive than surgery, and there are a lot of patients who are simply not surgical candidates, or the surgery would be very invasive and come with a very high risk profile. So we can offer procedures to those patients that are much safer and that allow them to go home much earlier than they would after a very invasive surgery. That being said, we do work very closely with the surgeons here, and they're actually our biggest supporters. So just
a broad range of cases, from something as less complex as a liver biopsy to the more complex cases like TACEs. I think our biggest take home from every procedure that we have assisted with over here has been understanding how to work in a minimal resource setting with the most efficiency.
Yeah, for sure. And I think another thing too, seeing the residents is so inspiring, to see how motivated they are. They are very kind of willing and ready to jump onto the cases and whatnot.
They are hungry for education, and you can see it in every step. They come in early, they present their cases, they basically set up everything, the table, the patient, get the equipment. So they are they are trying to be their own tech. They're trying to be like the student. They're also trying to learn, and I think think that working with the attendings that, have been so graciously come with Road2IR has been, a wonderful experience for them as well as for us.
And the pathology too has been, it's
Oh my
impressive.
God.
I don't think it's
been crazy.
what we see back in the US. I mean,
Yeah.
most of these patients are presenting with late stage disease. So
Yeah.
some of the cases we're doing are for palliative purposes. We're able to bridge patients to chemotherapy and buy them time, maybe time with the family and whatnot.
It's sad, but it's also as a trainee, it's exciting. You learn a 360-degree care of the patient. The things we've seen here, just the sheer size and of the tumors that we've seen, it's been real.
We are the Muhimbili Radiology Residents. Welcome to Tanzania.
So as Diagnostic Radiology residents, we divided some of our time to be spent in the reading rooms. Most of us to observe the type of pathology they have there, but some of us got to dictate studies and discuss complex cases to share our input. We also joined in on the lectures of visiting professors, such as Dr. Risto Philippine, the chair of Tufts Radiology. As my co-residents said with their experience, similar experience were had in DR, where a lot of pathology is presented at their later stages, some which have advanced so far it is difficult to pinpoint the primary. This particular case was a patient who presented with jaundice. Due to the diffuse biliary dilatation, including the pancreatic duct, we were suspicious for a pancreatic head mass as the primary. Another case where the patient had diffuse metastasis, including the spine with pathologic fractures. We were not able to find the source of primary disease, unfortunately. As for working with the MUHA's Diagnostic Radiology residents, we prepared our lecture slides in advance after discussing with Dr. Frank Minja and the MUHA's chief resident, Vexi. We targeted to make lecture slides most beneficial to the MUHA's residents, where they perceived would make the most impact to their education. For example, they did not get enough breast radiology exposure, so I built my lecture around the basics of mammography. My co-residents, Abed and Harry, focused their efforts on GI, neuro, chest, etc. We really had a great time interacting with the residents there, as they were receptive, attentive, and interactive during our time together. Although we came from different backgrounds, we both shared our appreciation for radiology and the drive to be better at it.
Harry, what do we do after work hours?
Party every night.
you